Aboriginal Health Service in rural New South Wales. Before we begin, I'd like to acknowledge the traditional custodians of the lands on which we're meeting today, the RACMA people, and pay my respects to their elders past and present. I'd also like to acknowledge the traditional custodians of country throughout Australia, where telecare serves essentially all regions in Australia. And specifically for our partners, the Aboriginal Health Service, I'd like to acknowledge the Anawan, Gadilaray, Kurabo, Jakombo and Githabal peoples, and pay my respects to their elders past and present across the current towns of Indoor, Glennis, Tenterfoot and Tina. So a bit of background for those who don't know who telecare is, I'll keep it brief. We're essentially the largest telemedicine telehealth provider in Australia for non-GP specialist services. We have over 300 clinicians, specialists predominantly, providing care across 30 specialties, over 3,000 consults per month. And so we directly often partner with hospitals, other non-government organisations directly to provide specialist medical care directly to rural and regional hospitals and clinics. We're ISO certified and have been one of the main private sites for the Commission's pilot of the virtual care standards. So what occurred was that Armagen probably about a year ago, more than a year ago, came to us with a problem. So it's an Aboriginal health service in rural New South Wales, and their senior medical officer came to us with a problem that they had an outgoing retiring paediatrician, and they were about to lose essentially all paediatric services in those locations. And so over a period of 10 months, we co-designed a model together, and we launched that in November 2024. So as we know that in general terms, even in a non-Aboriginal and Indigenous population setting, there are only about 20 paediatricians that work outside of Metro Sydney anyway. And so there is a big shortage in any case of the paediatric workforce. Now when you layer that with the traditional barriers, the perceptions of health services and the lack of trust in the Indigenous setting, and the kind of issues around cultural safety, there is an increased kind of access gap essentially to the Indigenous population. We know that from the sites in the Armagen catchment, you'd be travelling 5 to 7 hours to cities like Newcastle or Sydney to access care. And so the solution was to co-design together a model that was safe for the Indigenous population, as well as working well with the local GPs, the local Aboriginal health workers, local nurses. And so it was a multidisciplinary team that we put together. We provided the paediatricians and the admin, and then we liaised directly with the Armagen Aboriginal Health Services workers to really ensure that the services that we provide were culturally safe, as well as bringing value to the community. So I'll skip over that slide. So basically, the weekly virtual clinics are delivered remotely by a virtual paediatrician who often lives in a metropolitan setting like Melbourne, Sydney, Brisbane, Perth. We generally roster the same paediatrician across the same services so that we can get that consistency and rapport and ongoing continuity of care. There was an element of kind of training on both ends where the cultural safety and the cultural training is increasingly embedded in a paediatrician's practice, and then the local staff also get the upskilling and the capability building with accessing a virtual specialist online. The other thing was, I forgot to mention, is that the on-the-ground staff did a lot of important work in terms of engaging with patients, understanding the context of each patient's family, their values, as well as doing all the basic physical monitoring And at times, the Aboriginal health workers would literally go to schools and grab the kids out of school and bring them into the clinic to have the virtual paediatric session and then take them back to school. So it's that kind of on-the-ground community involvement that we would be missing without the support of a local partner. So the results, we've facilitated about 150 consultations. The main hubs are still in Armidale and Inverell, but you can see that post-launch there's been a gradual scale-up, and we've had reviews, consults as well, which shows the continuity of care that patients are able to gain, even from a virtual service. 100% of respondents in staff and patient surveys felt culturally safe. 89% of respondents rated the experience A or above. And really it's about that, being cared for locally, don't have to travel, but also in a very safe and supported environment that they feel very comfortable in. There were some challenges, as with anything, there's always learnings. One thing we forgot to do was to get a localised number, so we're Melbourne based, and a 03 number calling you in New South Wales sometimes gets treated as spam. So we normally know to get a local number, but we forgot in this case. And the upskilling opportunities, the staff feedback was that it wasn't as good as an outreach paediatrician, where you had that informal corridor conversation, tea room conversation, and so we're trying to build that in as maybe an extra time at the end of sessions to catch up and discuss cases with the local staff so that they get a bit of upskilling. And so I think in conclusion, this model works really well in paediatrics, but there's no reason why it can't be rolled out across